I'm Elisa with justorthopedic.com, and we are thrilled to be here on location at Pine Creek Medical Center in Dallas, Texas. We're located just north of UT Southwestern on Harry Hines Boulevard, and I have the pleasure of sitting across from Dr. Charles Whittenburg with Orthopedic Center of Arlington. Are you doing okay since the last time we spoke?
Yes, thank you.
Well, you know, for a normal Friday conversation, I think we should talk about chronic hip pain today.
That sounds like good.
Does
Sure.
that sound good? Of
course.
Can you tell us what some of the common causes of chronic hip pain might be?
In the clinic, I would say probably the three most common would be sciatica, which is just a general term that applies to any kind of nerve irritation of the large nerve going down that side of the hip. That can be from a lot of different causes, but it's something that's really common in the office. And then another one would be bursitis, which is just a inflammation on the very side of the hip directly over the bone. And then another one would be arthritis, which is actual inflammation, cartilage wear inside the joint itself. Those would be probably the three most common that we see.
So do you have more conservative treatments that you try first?
Yeah, generally, you know, you would start with, like in the case of sciatica, stretches and physical therapy and things that are designed to relax the muscles around the area where that nerve exits the pelvis and goes down into the thigh. Again, therapy, stretches, anti-inflammatories, those kinds of things. For hip bursitis, kind of the same. Maybe an anti-inflammatory, occasionally an injection. We usually monitor that condition with injections. And then hip arthritis is, like we said, a degenerative condition of the hip joint itself, possibly involving the cartilage or wearing away of the cartilage. We usually start that with conservative treatments as well, such as anti-inflammatories, but progressing all the way to hip replacement in some cases.
So if none of the conservative treatments work, is surgery their only option typically?
Typically for hip replacement, yeah.
Okay. Well, thank you for such great information again this afternoon. We really appreciate it. This is Dr. Charles Whittenburg with Orthopedic Center of Arlington. I'm Elisa with justorthopedic.com, and follow us on Facebook, LinkedIn, and Twitter.